The Honourable Leader of the Official Opposition.
Thank you. Thank you, Mr. Speaker. Thank you, Mr. Speaker. In 2013, the Premier promised Nova Scotians that each and every one of us would have a family doctor. I think it's charitable to say that the government has fallen just a little short on that commitment, Mr. Speaker. Bill number 1, introduced almost 5 years ago to this day, created the Nova Scotia Health Authority. But from an interview with Janet Knox this summer, we learned that the Premier waited almost 2 years to give the Nova Scotia Health Authority responsibility for doctor recruitment. My question for the Premier: if doctors were the centerpiece promise and the Nova Scotia Health Authority was the first act of business for this government, why did it take so long to get the Nova Scotia Health Authority working on doctor recruitment?
The Honourable Premier.
Thank you, Mr. Speaker. First of all, I want to thank the Honourable for the question, Mr. Speaker, and I want to thank Janet Knox for her tremendous service to people of Nova Scotia to help us transition into a single health authority. The Honourable Member is correct. As we transition from the 9 district health authorities and silos that were created across this province, took a period of time to unite all of the different organizations to ensure that we streamlined the process, Mr. Speaker. As you would know, before that would have been handed over to the Health Authority. There was work ongoing through the Department of Health that had been happening under successive governments, Mr. Speaker. When it became time that the Health Authority was ready to deal with the issue, we were transferred that responsibility to the District Health Authority.
The Honourable Leader of the Official Opposition.
Mr. Speaker, the former district health authorities handled the recruitment. There was never an issue like there is now, and for the Premier to suggest to Nova Scotians that he had to wait for 2 years until he was ready to focus on doctor recruitment, that is part of the reason why we are where we are right now, Mr. Speaker. When the Premier ultimately gave responsibility to the Nova Scotia Health Authority, it came with all of 1 full-time equivalent, 1 person. And we still don't know exactly how many Nova Scotians are without a doctor. And this government had missed out on many recruiting opportunities, like last year's meeting in Newfoundland. We're starting the 7th year of this government, and the healthcare issue, the crisis, is the #1 issue on the minds of Nova Scotians. Can the Premier tell this House how many Nova Scotians are without a family doctor today, but more importantly, how many doctors are actually needed to close the gap?
The Honourable Premier.
Mr. Speaker, again, I want to thank the Honourable Member for the question. Mr. Speaker, he would know we continue to recruit physicians into our province. He would also know, Mr. Speaker, that Nova Scotia is number 4th in the country when it comes to attaching citizens to primary caregiver. Mr. Speaker, that means there are only 3 Canadian provinces who do better than we are. He would also know the phenomenon that has actually started, Mr. Speaker, when we district health authorities across the province. We continue to work in a collaborative way to look at this province, Mr. Speaker, holistically. Tomorrow we'll have our 2nd trip into the UK. That'll be great work by the Minister of Immigration. We've adapted a new immigration stream after working, Mr. Speaker, with the doctors, the 41 physicians that are either already practicing, Mr. Speaker, or are about to start practicing in this province. This stream will allow us to welcome more new Nova Scotians to come to continue to ensure that we provide primary care from one end of Nova Scotia to the other.
The Honourable Leader of the Official Opposition on his final supplementary.
Mr. Speaker, every time we ask these questions, we're promised a rosier tomorrow. Tomorrow will be better. And the reality is healthcare continues to get worse and worse. People are concerned about their ability to access healthcare. And despite the Premier's promises, the problem remains. Despite the creation of a giant health authority in Halifax, that health authority never made recruitment a priority for over 2 years. From the first day, the Premier has made promises on healthcare, but the problems continue to get worse. I wonder if the Premier would be willing today to restate his promise to find a doctor for every Nova Scotian.
The Honourable Premier.
Mr. Speaker, since this session started and the Honourable Member had been chosen to be the leader of his party, he stood in this House and accused Mr. Speaker of us that there were 100,000 Nova Scotians without a family doctor. Then he stood, Mr. Speaker, the next session and described there was only 50,000, Mr. Speaker, without a family doctor. By his own math, Mr. Speaker, we're moving in the right direction, and quite frankly, Mr. Speaker, we are joining the leaders in the country when it comes, Mr. Speaker, to fighting for a global shortage of family physicians, and we are winning.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, I want to ask the Premier about some areas of real struggle in the province. One of these is rental housing. 20% of renters in the province are paying out more than half of their income in the rent. And people are regularly reporting having to leave their homes because of sudden rent increases that are in the hundreds of dollars. And there is a solution to this problem: rent control. Other jurisdictions have adopted this solution, as we in Nova Scotia ourselves had it until it was done away by the Liberal Party in the 1990s. Will the Premier acknowledge, as his government comes towards its 6th year in office, that a lot of people are having a very hard time because of this government's tepid and inadequate approach to rental housing?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the honourable question for raising this very important issue. He's very right, Mr. Speaker. Housing can be a real challenge for many Nova Scotians, eating up much of their disposable income, Mr. Speaker, when it comes to trying to make sure they put a roof over their family. Mr. Speaker, it's why we brought in rent supplements, continue to work with people across our province to provide them with a safe home. We're very pleased with the housing announcement we made with the national government. Mr. Speaker, there were some announcements about improving our own infrastructure when it comes to our own housing across the province to ensure that we have more affordable units in communities from one end of Nova Scotia to the other, and then continuing to make sure that we're providing affordable housing, Mr. Speaker, as we continue to see this city grow.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, a second area where many people are really struggling is the area of getting access to mental health support. Wait times that are measured in months to see a mental health clinician are a scandal in our province. And this, too, is a problem that has solutions. In PEI, in Ontario, and Newfoundland, Labrador, and BC, they have developed systems of same-day, next-day counselling appointments for people needing mental health supports. But here in Nova Scotia, nothing of the sort has been brought forward. As we stand at almost the 6-year mark of his period in office, does the Premier realize how disappointing this lack of real improvement on this front is to so many people in our province?
The Honourable Premier.
Thank you, Mr. Speaker. Again, I want to thank the Honourable for bringing this important issue to the floor of the legislature. He would know, Mr. Speaker, we've continued to invest in Schools Plus. We're providing more opportunities in schools across the province for early identification and detection of mental health issues. That's what our panel of experts have identified. He would know that we continue to expand Caper-based program, that was something started in Cape Breton that we're using across the province to provide supports for families and those suffering from mental illness, Mr. Speaker. We've increased the funding at Lang House to provide those supports. There's always more work for us to do, Mr. Speaker. We continue to reach out to the experts to get evidence-based solutions to the challenges facing our province to ensure that we can provide the entire supports, not only around those who are suffering mental health, but around those who love them.
The Honourable Leader of the New Democratic Party on his final supplementary.
As we speak about areas of struggle today in Nova Scotia, there's no greater area of struggle than the climate emergency. This, as the Speaker has rightly said, the defining challenge of the era. But here again, there is in our province a path in the direction of solutions. All over the world, scientists, NGOs, other jurisdictions are putting forward plans, are putting forward goals for emissions reduction targets that are actually consistent with containing global heating within 1.5 degrees. But here in Nova Scotia, at the almost 6-year mark in office, this government has failed to put forward any kind of transformative solutions towards such a framework. Does the Premier recognize, here on the eve of the climate strike, that the government's record on climate change is for so many people in our province an object of dismay?
The Honourable Premier.
Thank you, Mr. Speaker. Again, Mr. Speaker, I want to thank the Honourable member for the question. That will be part of our emergency debate tonight, Mr. Speaker. I look forward to hearing all members of the House comments on this very important issue. Very proud of the work that not only we've been doing as a government, but quite frankly, successive governments in the province have been doing to lead towards a national leader in GHG reduction. We continue to work towards ensuring that we reduce our carbon footprint. We will continue to make sure, Mr. Speaker, that we're leading the country. There will be targets set, Mr. Speaker, for us to achieve, and we'll exceed the limits or the targets set out by the federal government, Mr. Speaker, because Nova Scotians have been doing that work really since the mid-2000s, and we as a government look forward to continuing the effort that so many Nova Scotians have put in.
The Honourable Leader of the Official Opposition.
Mr. Speaker, in August, Nova Scotians learned of a tragic incident at Soldiers Memorial in Middleton. A patient was waiting at that hospital to be transferred to another hospital, Valley Regional, for a scan. He and his wife waited and waited and waited. He eventually lost consciousness due to a brain bleed and passed. That ambulance still didn't arrive, Mr. Speaker. This shouldn't be happening in this province. I'd like to ask the Premier, do situations like this causes government to stop and realize that this is a system that's an absolute crisis?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the gentleman for the question. I represent, Mr. Speaker, that community, that hospital. It's one important part of providing care to my family, to the people that I represent. The incident that the honourable member refers to, Mr. Speaker, is under investigation, and we will ensure that information will be turned over to the family as soon as the investigation is complete.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker, and I appreciate the Premier's response on that specific incident. But the issue is there's too many incidents around the province. Too many people are concerned about their ability to access care. We've said time and time again in this House, if you are unwilling to recognize that there's a crisis, you will be unwilling to solve it. And this is a government that needs to take a hard look at service delivery. This is a government that needs to start listening to frontline healthcare workers. This is a government that needs to really acknowledge the issues that are happening in the system right now. And if these types of incidents aren't enough for the Premier to stop and listen to frontline healthcare workers, we have to wonder what will be enough.
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the honourable member for his question. I want to thank all those frontline healthcare workers across the province. He would know, Mr. Speaker, we work with Nova Scotia Nurses Union to ensure we deal with violence that's happening in the workplace and emergency rooms across the province. I want to thank that organization for its tremendous help. We continue to work with healthcare providers who are providing primary care to ensure that we have the infrastructure of today, Mr. Speaker. We've been fought at every step of the way when we want to make investments to improve healthcare infrastructure in communities that will help us attract, retain more healthcare providers, provide the services that Nova Scotia wants as close to home as possible as we continue to build a modern healthcare facility, Mr. Speaker. And the reality of it is, though, Mr. Speaker, let me be very clear about this. I get stopped on many streets, Mr. Speaker. There are those who ask me about finding a doctor, but there are many, many more who tell me that their experience in the healthcare system in this province has been nothing but first rate and first class.
The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. My question is for the Minister of Finance. After Hurricane Dorian made landfall in the province, many people lost food and had damage to their homes and businesses. For 3 weeks, a private company, the WM Fares Group, left a large crane, now a tourist attraction, that had collapsed onto a building under construction, endangering public safety, closing local businesses, and forcing people out of their homes. Due to this inaction, last week the government took over management and financing of the removal of that crane, which is still lying crumpled on South Park Street. Nova Scotians have questions about the financial impact of the government stepping in to help one large private company. Mr. Speaker, can the minister assure Nova Scotians exactly how she plans to recover the uncertain costs related to this government decision?
The Honourable Minister of Finance.
Thank you, Mr. Speaker, and thank you to the member for the question. I think it's important for all Nova Scotians to understand, and I believe all Nova Scotians, especially those impacted, appreciate the fact that the decision that this government made was to, first of all, provide protection for people and property, and as a result of that, the area has been out of bounds. It has been declared an emergency area. That's the first step. That's what people want. They want to know that their people, their property will be protected, and we took the first step to do that.
The Honourable House Leader for the New Democratic Party.
Mr. Speaker, my question was how the government would recover the cost of that action, especially since, given the uncertainty, another concern that Nova Scotians have is about the perceived conflict of interest in this particular decision. Directors of the WM Fares Group are major donors to the Liberal Party, Mr. Speaker, contributing more than $10,000 over the 6 years this government has been in office, and I'll table those records. Mr. Speaker, did the minister or her government consult with the Conflict of Interest Commissioner before making the decision to assume all liability for the crane belonging to the WM Fares Group?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the honourable for the question. As she would know, Mr. Speaker, the crane does not belong to MW Fares Group, Mr. Speaker. The crane is an independent firm, Mr. Speaker. The crane did not collapse on MW Fares facility, Mr. Speaker. It collapsed on an adjacent building. The reality of it is, Mr. Speaker, this is about public safety. and to impugn the reputation, Mr. Speaker, of someone who's contributed to many political parties in this province for political gain, Mr. Speaker, it's pretty early in this session to take that step. The reality of this is about securing that Nova Scotians will have a safe community to live in. We will remove that train, we will take crane, and we will take every step to recoup the loss to the people of Nova Scotia.
The honourable member for Pictou West.
Thank you very much, Mr. Speaker. My question is for the Minister of Health and Wellness. Nova Scotians are increasingly worried about getting an ambulance when they need one. We hear it every day. Nearly a year ago, the Department of Health and Wellness spent $145,000 on a report on recommendations to create, and I quote, an efficient, effective, and sustainable EMS system, and I will table that. That report, Mr. Speaker, was due December 2018. That deadline, however, has come and gone without any clarity on the status of the report. So my question to the Minister, has he received the Fitch and Associates report on the EMS system?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for the question. Indeed, I appreciate, as she does, the concerns that Nova Scotians have with and also the confidence we have in the EHS system to be there for us when we dial 911. The member's correct. There's a report that's been worked on. That work is continuing. I had an update just a couple of weeks ago that indicated the report is essentially finished. They're going through last-minute data validation, verification in the report before it is submitted to me. Thank you.
The honourable member for Pictou West.
Wow, 11 months. I do have confidence in our paramedics. I don't have confidence in this Liberal government. I have to wonder, though, why this government is so eager, Mr. Speaker, to pay for reports and recommendations, yet so unclear on the status of those reports and the conclusions made in those recommendations. This report simply could have a critical, Mr. Speaker, a critical impact on the emergency care for Nova Scotians. But they're more concerned, for whatever reason, why this government will not be forthcoming with the report's conclusions. And the minister has been quoted. And I would like to ask the minister, can he confirm if this report will ever be made public or only kept within his office? Or will Nova Scotians have a chance to see this report? Perhaps we will all have to file a Freedom of Information request in order to see it.
The Honourable Minister of Health.
Thank you, Mr. Speaker. I guess first and foremost, to address the member's confidence in myself and the government, the Department of Health and Wellness, and our partners at EHS and the Health Authority. Indeed, Mr. Speaker, I've also been quoted and spoken publicly, Mr. Speaker, on the fact that I wasn't waiting for the Fitch report to take action, Mr. Speaker, to improve aspects of our healthcare system and the emergency system, Mr. Speaker. With the directive that I provided, Mr. Speaker, back in the spring, we've seen the Health Authority and EHS respond by taking steps, Mr. Speaker, upon the review. We've seen improvements in the ambulance offload times, Mr. Speaker, dramatic improvements that hadn't been seen for many years. The problem had been getting worse under successive governments, Mr. Speaker. We took action, took advice from the front lines, and implemented that advice.
The honourable member for Pictou West.
Thank you, Mr. Speaker. This is a great segue into my next question. Earlier this year, the Nova Scotia Health Authority announced new offload times for ambulances at the 5 busiest emergency departments in this province. The Minister of Health expressed this would ease the number of emergency patients waiting in hallways and the number of ambulances delayed from responding to calls. But we have heard from critics and we've heard from Nova Scotians that setting new standards without the appropriate resources wouldn't do much. And we've witnessed that, and I will table this document. So can the minister confirm what percentage actually of offloads at the 5 pilot emergency hospitals have been completed within the 30 minutes?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Directive was made earlier this year, as the member noted, to have the Health Authority and EHS work together to improve the transfer. That offload that the member is referencing is the transfer from an ambulance that arrives at the emergency department into the hospital environment. And, Mr. Speaker, we've seen improvements, for example, at the Halifax Infirmary, one of the busiest emergency departments, where the offload time averaged somewhere in the vicinity of 180 minutes, Mr. Speaker. It's down somewhere in the vicinity of 60 minutes, Mr. Speaker. That's a significant improvement in just a few months. There's still more work to do, Mr. Speaker, but we're seeing progress on that work.
The honourable member for Pictou West.
The problem is that there's no consistency across this province, so not everyone is being treated equal. Mr. Speaker, these guidelines are intended to help balance the intense pressures that paramedics are under, and as well ensure that an ambulance is available when someone needs one. We know from cases reported over the summer that that is simply not the case. And they are not available, Mr. Speaker, in critical cases that literally constitute a life or death scenario. Once again, the Premier has admitted there's a case being investigated right now. Paramedics and patients are both desperate to know if these new offload measures are working, and if so, when will they be rolled out to other hospitals? So my question is, when will these new standards be introduced at additional emergency departments across this province? And if so, please name the ones.
The Honourable Minister of Health.
Thank you, Mr. Speaker. As I've previously indicated, the Nova Scotia Health Authority did take the direction to heart. They work together, and I want to recognize and acknowledge, Mr. Speaker, the staff and the frontline healthcare personnel who have been part of that. Mr. Speaker, we hosted earlier this year in Halifax the National Emergency Department physicians. And, Mr. Speaker, there are about half a dozen Nova Scotia emergency physicians that I bumped into during that time, Mr. Speaker, who lauded me, Mr. Speaker, for taking the steps that we did. They said they have never seen that type of initiative, and they recognized that it was the direction that I gave to the Health Authority that allowed the system to start making these positive changes. So it's listening, Mr. Speaker, to the frontline healthcare professionals, and we're receiving the feedback from those emergency doctors and paramedics on the front line that they're seeing these improvements on the front line.
The honourable member for Argyle-Barrington.
Thank you very much, Mr. Speaker. I am one of those frontline healthcare workers, and I've worked in healthcare for nearly 5 years as a paramedic. I've heard from dozens of paramedics about being overworked, about having to work overtime hours shift after shift, about having trouble even getting a bathroom break. I acknowledge that the Minister of Health has met with some paramedics and is doing his best to listen to their concerns. But the persistent state of chaos in the system and the problems that they're still dealing with day after day, month after month, suggests that not enough action or not enough of the right action is being done. It's great for the minister to stand here and say, we're listening, we're working together, but people are concerned, and people want to see data supporting those claims. What analysis has the department conducted to determine if the new emergency offload standards have improved or worsened burnout rates for paramedics?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I'll take a brief moment to acknowledge the member and his first question in the legislature. Welcome here, and congratulations on your first question. Mr. Speaker, as I've previously noted, we continue to monitor the offload times and the performance, Mr. Speaker, for paramedics transferring patients into emergency departments at those hospitals. The one that I recall that stands out certainly the most significant was the location that had the longest average times for transfer, and one that impacted paramedics from across the province, Mr. Speaker, because it was here at the HI where patients could be transferred in from really anywhere in the province to receive that advanced level of care at that site. And, Mr. Speaker, we've seen a reduction in wait from about 180 minutes down to 60 minutes, and it's been less than 6 months in that effort, Mr. Speaker, and we're continuing that effort to improve, continue those improvements in emergency department paramedic offloads, but also throughout the healthcare system.
The honourable member for Argyle-Barrington.
Thank you very much, Mr. Speaker. This caucus stood in this House last year and discussed this very issue about paramedic burnout. We asked the minister if he'd taken up the offer from paramedics to spend a 12-hour shift experiencing what the job actually is like on the ground. The minister's answer at the time left some uncertainty as to whether that had happened, and I'll table his answer. It's been a year, Has the minister found time to take part in a full 12-hour shift with paramedics as previously promised in this House?
The Honourable Minister of Health.
Thank you, Mr. Speaker. As previously acknowledged in the legislature, I did attend a ride-along, Mr. Speaker, with EHS. It was probably about a year ago. I don't remember the exact dates, Mr. Speaker, and that was an opportunity for me to see. We stopped, Mr. Speaker, at various hospitals, bases, etc., to talk to the paramedics in the line of duty while they were waiting in the hallway, for example, at the QE2. But also, Mr. Speaker, talking to them at Dartmouth General, where they spoke very highly of the offload program that they had in place at that transition unit, Mr. Speaker, and that was a very informative experience for me, hearing directly from them. And Mr. Speaker, I also engage obviously with the union representatives and hear from them. And on the topic of burnout, Mr. Speaker, the feedback that I got from the union representatives is that addressing the offload time was one of the most important steps that I could take to address that burnout concerns.
The Honourable Member for Argyll-Barrington.
Thank you very much, Mr. Speaker. 2 weeks ago, paramedics issued 9 code-critical warnings about low ambulance availability in a 7-day span. The week prior, there were 7 instances of code-critical across Nova Scotia. In the month of August, paramedics reported a total of 41 code-critical warnings. This is particularly worrisome because these new ambulance offload guidelines were intended to reduce the incidences of code-critical, but it doesn't seem like they have. Mr. Speaker, can the minister explain why code-critical instances have continued across the province, even with the new offload guidelines?
The Honourable Minister of Health.
Thank you, Mr. Speaker. As we've been discussing, one of the really the primary concern. It was the primary concern when asked in terms of prioritizing of paramedics that I heard from both frontline and from union representatives was addressing the issue of offload times. That is the transfer time that it takes when an ambulance shows up at a hospital to transfer them into the care of the hospital facility that they're visiting. Mr. Speaker, we saw the reports, Mr. Speaker, we saw the news. Patients would see and people in the communities would see ambulances backed up outside of the Halifax Infirmary and other hospitals around the province. That's why that was a focal point, Mr. Speaker. It's the action that we took, and we're seeing those improvements, Mr. Speaker. The work is not done. We'll continue to work with the Nova Scotia Health Authority, EHS, and our other healthcare partners to see more improvements.
The Honourable Member for Argyll-Barrington.
Thank you very much, Mr. Speaker. Again, I appreciate the minister's assurance that there's progress and hard work, but we're interested in the data and the data that the minister and the NSHA are relying on. Paramedics have been publicizing code-critical calls for years. This concern speaks to the very heart of the healthcare crisis here in Nova Scotia. Nova Scotians want to know, will the system be there when they need it? Will an ambulance arrive in an acceptable time frame when they need it? Data can ease their fears, but where is the data? Mr. Speaker, does the department itself collect its own data on instances of code-critical throughout the province, and will it commit to making it public if so? Thank you.
Honourable Minister of Health.
Thank you, Mr. Speaker. I believe, first I want to clarify for the members of the legislature that the reference to the term code critical is not a code or a reference to a program or identified term for within the Department of Health or the healthcare system, Mr. Speaker. I believe that's a part of work within the union environment to draw attention to concerns that they have, Mr. Speaker. So the terminology there, so to answer the member's question, that's not a particular item, but I assure the member opposite that we do monitor and track information around our EHS and other aspects of the healthcare system.
The Honourable Member for Cole Harbour, Eastern Passage.
Thank you, Mr. Speaker. Even if people manage to get offloaded into emerge, there's often nowhere for them to go. We've got over 20% or 700 frail seniors sitting in acute care beds waiting for long-term care. Last spring, a vice president of the Nova Scotia Health Authority noted that the ambulance and emergency care problem is compounded by the lack of long-term care beds. He said There are an increasing number of individuals who need housing or accommodation or long-term care, but their needs are becoming very complicated, and it's very challenging for us to find locations for them to go, and I will table that. Mr. Speaker, this sounded to me like an acknowledgement that any changes to ambulance offload directives without sufficient funding for personnel is just window dressing until the very serious shortage of long-term care beds can be addressed. Mr. Speaker, will the minister acknowledge that there is a connection between the shortage of long-term care beds and the worsening situation and backlog in the emergency departments in Nova Scotia?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for the question. The member raises a concern that we're well aware of for Nova Scotians. I believe everyone in this legislature recognizes the importance of ensuring that the appropriate care, whether that's in our primary acute care system or in our long-term continuing care environment for Nova Scotians to receive the supports that they require. And that, Mr. Speaker, is why we continue. The member made reference to the offloads and being only one part of the work that needs to be done. That's true, Mr. Speaker. That's why the Nova Scotia Health Authority is also continuing the work looking at patient flow throughout the hospital system, Mr. Speaker, to improve those processes. And it's why, Mr. Speaker, we've announced, I believe, over 120 some new long-term care beds, Mr. Speaker. We continue to work and invest in home care programs and other programs, Mr. Speaker, to allow Nova Scotians to stay where they want to and continue care space.
The Honourable Member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker. One of the things I've gotten used to over the last couple of years is that announcing 120 new beds when you need at least 2,000 doesn't reassure very many Nova Scotians. Mr. Speaker, the simple fact of the matter is that this government has had oversight of this matter for over 6 years, and for those 6 years, issues around long-term care beds and ambulance availability have persisted. They've gotten worse under this government, and there is no way other to frame it. This is a crisis this government has denied, and it's a crisis this government has paid lip service to. So I'd like to ask the minister, considering that a couple of weeks ago I was in the Emerge with 2 people who attempted suicide and were sent home within 24 hours, why has the minister taken only minor steps to improve the number of long-term care beds in this province, and does he agree that this is having a dramatic impact on the health and home care for seniors in this province?
The Honourable Minister of Health.
Thank you, Mr. Speaker. And I guess you would rule perhaps that there's a disagreement of fact between myself and the member opposite, where she had suggested or stated that the wait times have only gotten worse under this government. In fact, Mr. Speaker, if the member wishes to compare the wait list for continuing care, long-term care services, when we came into government in 2013 and what they are today, Mr. Speaker, we've seen a reduction in the wait list of almost about 50%, Mr. Speaker. Mr. Speaker, we've seen a reduction in the number of people waiting both in hospital, waiting to be discharged to a long-term care facility, as well as those people waiting in their home or in their community for long-term care accommodations. And Mr. Speaker, not just the number of people waiting, but how long they wait has also been reduced significantly.
The Honourable Member for Cape Breton Centre.
Mr. Speaker, my question is to the Minister of Health and Wellness. We know from the Minister's expert panel on long-term care that people living in nursing homes need more help than they did 20 years ago. Residents are older when they move into nursing homes today than a generation ago. Residents also entering nursing homes are much more frail than they used to be, and many more use mobility devices like wheelchairs and walkers than residents have in the past. Many nursing homes were built for a more mobile population. Mr. Speaker, in the event of the need for an emergency evacuation in the case of a fire or natural disaster like Hurricane Dorian, how confident is the Minister of Health that nursing home residents would all get out safely?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and the member's correct. It was about a year ago, as of now, about a year ago, when we implemented or established the expert panel on long-term care. They did their work, Mr. Speaker, provided me and the government with a number of recommendations, about 22 specific recommendations to improve the quality of care within our long-term care sector, Mr. Speaker. I provided an update to Nova Scotians yesterday, Mr. Speaker, and I'm happy to table that report card, which is available online for all Nova Scotians, as to the progress we're making and the work that remains to be done to continue this important work and improve the quality of care in our long-term care sector for those Nova Scotians who need that care.
The honourable member for Cape Breton Centre.
Thank you, Mr. Speaker. Sadly, the report card won't help the seniors get out in case of a disaster. Mr. Speaker, yesterday's announcement that the government will allow retired RNs to work as continuing care assistants in nursing homes does nothing to solve the problem that our continuing care facilities are facing. It is the staffing ratios that need to be improved. The current workload of CCAs makes providing adequate care to seniors impossible, and I don't know what is so hard for this government to understand. Mr. Speaker, if the staffing levels in our nursing home are not adequate to ensure that residents get to go to the bathroom when they need to pee, Mr. Speaker, what would happen to these residents in the case of an evacuation?
The Honourable Minister of Health.
Thank you, Mr. Speaker. First, I want to assure the member opposite that, in fact, we have various reviews and inspections that do take place in the emergency processes, Mr. Speaker, and indeed requirements under the fire marshal and rules and assessments also take place, Mr. Speaker, to ensure the safety of our residents. Mr. Speaker, in terms of the staffing aspect, Mr. Speaker, the member's correct. Staffing is an important part, and many of those recommendations of the expert panel focus exactly on that. But, Mr. Speaker, the announcements that I made yesterday were two initiatives, Mr. Speaker, to address what we recognize as a concern. Regardless of what the ratios are, Mr. Speaker, there are many sites that are understaffed because they don't have the workforce available to fill the positions. They're chronic vacancies, Mr. Speaker, and the announcements that we did yesterday following the direction and advice of the expert panel was to make changes to help address that immediate concern and get support in those sites that are there today for those chronic vacancies.
The honourable member for Victoria the Lakes.
Thank you, Mr. Speaker. Mr. Speaker, my question as well is to the Minister of Health and Wellness. This summer, residents of Paramedics and the surrounding area were very troubled by a sharp increase in visits to the emergency room of the Victoria County Memorial Hospital. A family doctor at the hospital said that overcrowding at Cape Breton Regional and closures elsewhere forced patients to drive from as far away as Lewisburg and Escazone for treatment in Paramedics. That influx of unexpected patients fell to the 4 family doctors that struggled to treat the hospital's emergency patients while also managing their own practices. And I'll table that, Mr. Speaker. So my question to the Minister, can the Minister confirm the percentage increase in emergency room visits to the Victoria County Memorial over the summer?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for the question. Obviously, Mr. Speaker, we know that health care broadly and emergency care access is important to Nova Scotians. And Mr. Speaker, that's why we've been taking steps to help improve the access to care and maintain emergency coverage. Mr. Speaker, some of the steps that we've been taking include establishing and enhancing locum incentive programs to cover emergency department shifts. And through those initiatives, Mr. Speaker, we've seen almost 600 days of emergency department coverage because of those changes we've made in the last year. Again, the work's not done. These are just some of the parts that we are taking to help address those pressures in emergency departments across the province.
The honourable member for Victoria the Lakes.
Thank you, Mr. Speaker. Mr. Speaker, action or inaction has consequences. Dr. David Ewan says those consequences include times when they run out of stretchers, and the corner of the hallway that is normally used for linens is now a patient area. They include days where no ambulances can be offloaded at all. And they include instances of triple closures at North Sydney, New Waterford and Glace Bay, going from rare to routine, according to the Victoria Memorial physicians. And I'll table that as well, Mr. Speaker. The doctors have said they have received only lip service from the Department of Health and the Health Authority. So my question to the Minister, will the Minister admit that these are consequences of this government's failure to plan for appropriate resources in health care?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Again, the member's raising concerns and also highlights through his question the integrated nature of our healthcare system, Mr. Speaker, recognizing the interdependency of resources and facilities. And that's why, Mr. Speaker, we recognize that in Cape Breton Island, the importance of emergency department and a strong emergency department, particularly at the Cape Breton Regional facility, Mr. Speaker. In 2017, when I was first appointed Minister of Health and Wellness, one of the first hospital sites that I visited was the Cape Breton Regional. And one of the most significant parts on that tour, Mr. Speaker, was the emergency department, where they stressed how that emergency department was not adequate, was not large enough to provide the care for the people in that region, Mr. Speaker. And that's why we have a capital initiative underway that we've announced in the redevelopment of Cape Breton's hospital infrastructure. We're more than doubling the size of that emergency department, Mr. Speaker, to address the very concern that the member has raised.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. My question is for the Minister of Communities, Cultures and Heritage. The grounds of the Truro Amateur Athletics Club, or the TAC, have been a popular spot for sport and outdoor activity for over a century. Over time, the grounds have fallen into a state of disrepair. At one time, TAC hosted provincial and regional track events, but that's no longer an option in its current state. A fundraising drive has been launched, pulling in well over $600,000 from the community and $1 million in kind from the County of Colchester and the town of Truro. But the TAC Revitalization Committee needs provincial support to get across the finish line. My question for the minister is, has the province considered any level of financial support for the TAC Revitalization project in Truro?
The Honourable Minister of Communities, Culture and Heritage.
Thank you very much, Mr. Speaker, and I want to thank the member for an important question, as sport and recreation infrastructure is of great importance across Nova Scotia. In this particular year, we've invested heavily in a number of major projects. I'm certainly pleased with the $1 million we put into 29 trail projects. In regards to the project that the member references, I met in June with Brian Wood to take a look at the existing facility and to hear from the Truro Amateur Athletic Club Revitalization Society as to what their plans are, and I know our department now is engaged in those discussions.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker, and I appreciate the minister's response. It's an important project for the community. As we can see, the TAC, the committee, has sought and received support from the county and from the town. We know that the community is supporting it and willing to push it forward. We also know in other cases across the province where the province went ahead and picked up the share, the municipality's share for a tab of a track facility, and of course that facility happened to be in the Premier's constituency, Mr. Speaker. So we need to make sure that the province is treating communities fairly and is not willing to pick up the tab, no questions asked, for a community project just because it's in the Premier's constituency, while other communities like Truro are forced to scrape by. So can the minister maybe inform the House as to when his department intends to respond to the committee, the TAC committee, as to whether they'll be able to proceed with their project, just like the Premier's community was?
The Honourable Minister of Communities, Culture and Heritage.
Thank you very much, Mr. Speaker. And I do want to point out that Truro and that area is a very significant track and field community. Cobequid has had a remarkable history in terms of championships and track and field achievements. So certainly our department will work very closely, and we've already had a conversation with the MP prior to the federal election, and it is my belief that the County of Colchester, the province, and the federal government, we'll all four levels of government will work for a successful project in Truro.
The Honourable Member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker. On June 18th, the medical director of Ocean View Continuing Care Centre sent a letter to the Department of Health and Wellness and the Nova Scotia Health Authority advising them and their only other part-time doctor that both doctors were leaving effective September 19th. I was advised during our last Health Committee meeting that a normal response from these two departments to a letter like this would be 1 to 3 days. Mr. Speaker, it took 6 weeks before the medical director had a response, and it was simply an acknowledgement that they sent out an email to doctors to express a request for interest. It took the halting of admissions to this long-term care facility before a meeting was held 2.5 months later. Can the Minister of Health tell me if halting admissions to the long-term care facility is the only thing that will get the attention of the Department of Health and Wellness and the Nova Scotia Health Authority these days?
The Honourable Minister of Health.
Thank you, Mr. Speaker. As we've been discussing quite at length today, indeed, the care that's provided, and the importance to ensure that that care is available to our loved ones requiring long-term care, or if it's in the community in their home care settings, is important, Mr. Speaker. And that's why we continue as a government to recognize those needs, to invest heavily in home care supports to allow Nova Scotians to stay home, recognizing the caregivers that support them. And indeed, in the long-term care sector, Mr. Speaker, we have a plan in place with guidance from the expert panel. And Mr. Speaker, I assure the member opposite that when facilities have needs, that when they reach out to the department, indeed, I would expect a quicker turnaround than 6 weeks.
The Honourable Member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker, and I appreciate the acknowledgement that 6 weeks is too long. My cousin lives in that facility, and I certainly hope that they find physicians for it soon. Mr. Speaker, though this is not the only issue facing our long-term care system, the Veterans Memorial Hospital has federally funded long-term care beds for our veterans, but the facility itself is owned and funded by the province. Veterans groups have been advocating for the spouses of veterans to be able to live at the Veterans Memorial Hospital for decades. This requires the province to certify the Veterans Hospital as a long-term care facility, which they still have not done. And this despite the fact that there are empty beds within the hospital. My question to the Minister of Health, can he tell us why this government continues to drag its feet in supporting veterans in care and their families who want to be reunited?
The Honourable Minister of Health.
Thank you, Mr. Speaker. As the member noted, there are spaces available that are under the purview and management paid for by Veterans Affairs Canada, Mr. Speaker. The eligibility for utilizing those spaces does fall to them, Mr. Speaker. Certainly the province is ready and willing and able to work with our federal counterparts at Veterans Affairs Canada should they change the eligibility criteria for accessing those beds for which they pay for.
The Honourable Member for Cumberland South.
Thank you, Mr. Speaker. Mr. Speaker, a year ago, the area of Oxford lost a gem when the Oxford Lions Park was closed due to a sinkhole development in that property. Since that time, the community has worked with both provincial and federal governments to secure funding for the geotechnical and geophysical investigation of the Lions Park property. The results of this study are not good news for the future of the Lions Park. My question to the Minister of Transportation: does his department have an abatement plan to address the evolving sinkhole problem?
The Honourable Minister of Transportation.
Thank you very much, Mr. Speaker, and I thank the member opposite for the question. The department is engaged in determining the extent of the concern that has been expressed in the area with regard to the highway next door there, and we are in the process of undertaking a drilling program to do testing at the site to determine just what the threat is to the sinkhole area.
The Honourable Member for Cumberland South.
Mr. Speaker, I thank the Minister for that information. The CBC has been following this issue ever since it started, and the report came out in late August. And the residents about the safety of Highway 104. Visual inspections on that area show recurring potholes neighbouring the Lions Park and the surrounding properties of the Highway 104 and 321 routes. Aerial photographs from 1939 to 1962 show a possible sinkhole that the area, and it is now covered by the construction of the twinned highway of the Trans-Canada Highway, and I'll table that report. My question to the Minister: is his department conducting an actual test other than just drilling on this Highway 104 or Exit 6 area, or is he just waiting to visually see what happens?
The Honourable Minister of Transportation.
Thank you very much, Mr. Speaker, and thank the member opposite for the question. Sinkholes are naturally occurring throughout the province, and geologists have been aware of them and mapping them for years. Mr. Mr. Speaker, we put the safety of our traveling public as a #1 priority, and that's why we are undertaking a drilling program to determine just how extensive the situation is with regard to suspected sinkholes under the highway. Thank you.
The honourable member for Victoria the Lakes.
Thank you, Mr. Speaker. My question is to the Minister of Transportation Infrastructure Renewal. Recently, we learned that the ferry in Little Narrows will be replaced with a new and modernized vessel. In the past, a study was done to investigate the possibility of building a bridge to join the Little Narrows area with the peninsula in Iona. While there are advantages to each, there seems to be little information on why the department made the decision it did. So my question for the minister, can he please explain to this House why the department chose to build a new ferry rather than building a bridge?
The Honourable Minister of Transportation and Infrastructure Renewal.
Thank you very much, Mr. Speaker. And in Nova Scotia, our ferry system is extremely important to the travelling public. And all of the ferries, Mr. Speaker. In the instance of that particular one that's cited, the matter was the comparative costs associated with supplying a bridge. We've also looked at the possibility of a bridge at a very much busier ferry in the member opposites riding, the Englishtown ferry, and that one also, at this point, does not justify the cost of constructing a bridge.
The honourable member for Victoria the Lakes.
Thank you, Mr. Speaker. Can the minister provide the House with the revenues and expenditures of the Little Narrows ferry over the past 5 years to allow for a better understanding of why this decision was made and to also allow for further discussion on this matter?
The time allotted for question period has now expired.